Informed consent is essentially you asking the patient for permission to do essentially your job. Patients have the right to refuse anything from a cervical exam and labor, things like breaking your water or continuous fetal monitoring, really anything that is a part of their process. They have the right to give you permission to do those things.
You should have all the information you need before you make a decision regarding anything to do with your body or your healthcare, your baby's body, your baby's healthcare. And for us, it's really important that we don't assume we know everything and that what we're recommending is the exact right thing every time. We want you to understand what choices you have, and your choice may be different than our recommendation, and that's okay. We want you to be informed to make the choice you feel right about for your body, your baby, and your family.
We have a consent that explains the risks, the benefits, what we can offer, what we can't offer. And the biggest piece to informed consent is not the consent part, but the informed part. So you don't want to just hand somebody a piece of paper and ask them to sign it. For example, in the hospital, most of the time, the informed consent for an epidural is given to a patient when she requests the epidural. They don't read it, they just sign it. And that's not informed consent, that's just consent. So here we talk about things like if we should transfer to the hospital and you need an epidural, these are the risk benefits involved. So when they do get handed a piece of paper to sign, they are well informed and they do understand what they're signing.
You inform the patient as to what the procedure is, and you explain all the benefits and the risks that were going to happen during that time, and then they tell you if it is okay for you to do that.
The biggest thing is just making sure that patients are truly active participants in their care and making sure that they really understand the risks and benefits of everything that's being done, because particularly in birth, any type of intervention comes with its own set of risks. Explaining what we are doing and answering all of the patient's questions and making sure that they're understanding of what we are doing and why we are doing it. I don't ever want anybody to think that we're doing something to them without their permission. It's their body at the end of the day, and we want to appreciate that and make sure that they're comfortable with everything that's being done.
Informed consent is not only getting initial consent in prenatal visits for certain aspects of their care. A lot of our practice is surrounded around patient-centered care and wanting them to be the central part of their care team, and we just kind of function around that to help them have the best experience they can. We always try to reiterate when they're signing consent forms and everything that if at any point they change their mind or they have questions, they can always come back and withdraw that from us. We always are doing just information sharing and kind of that ongoing education. That way they feel they know all the information that's being shared with them about their care and their body, and they can make decisions for their health and their baby and kind of drive the force that's behind that in an informed manner.